to do the inspections in light of the coronavirus. We've asked for more communication with the Board of Health. We've asked them to consider a police detail 24/7. We've asked for documented emergency action plans and to share them with our public safety and public health departments. And until these items are addressed with public health and safety at risk, we're asking, for the Board of Health this evening to authorize the health director to issue an emergency order. So we've been in touch with KP Law.
I didn't catch that.
Working with us.
What was that?
Hello? Draft.
The last statements you made, I didn't hear it.
So we've asked the action items. Is that what you mean?
Yeah.
So we've asked for third-party inspections addressing the building code and fire code inspections, more communication from with the Board of Health. We've asked them to consider a police detail 24 hours a day, and we've asked them to provide police detail.
Police detail.
Yep.
Okay.
And their emergency action plans, and to share them with our departments. So until these items are addressed, we're asking the Board of Health to authorize the health director to issue an emergency order. And I'll let Melissa talk a little bit more about that. Melissa, do you have anything else you want to add?
So I think that you touched upon a lot. Obviously, on the health department side, due to investigations, this would be kind of a different situation because obviously these individuals wouldn't be residing in Walpole. They would be coming from the other facilities and coming to Walpole. So the health department would want to know what that means for us because obviously we keep track of any case that's within Walpole. So we would need to be made aware. The individual that was representing the home today said that DPH was well aware of this. So I know we've been on phone calls with DPH regularly over the last few weeks and we knew nothing about this. So we would definitely need some clarification on that. Obviously, it's not the best situation because we really just want to make sure that everyone's monitored properly. And we find it hard to believe that this can be done, provided the fact that you're going to have positive cases in one location and you're going to have different timing of each positive case. So you're going to have people starting day 1 when other people are coming in when they're on day 14. We don't know the risk of reinfection, obviously. Will it occur? We don't know. They are in a closed off area. They're going to be sharing restrooms. So yes, they could be sanitizing, but what is the procedures that are going to be in place to eliminate any spread of this virus within the facility? Another thing has to do with proper PPEs, making sure they have adequate PPEs, making sure that staff obviously has PPEs and that they're not coming in potentially bringing more virus in. So there's a lot of moving parts, I think, and I think for them not to tell us about what they were going to do, it really wasn't a good plan in place at all.
So what do you need from us, Melissa?
So we need your authorization to, we're going to draft up a letter and we're going to issue, so it'd be an emergency order to the facility. So we need the board's authority to allow me to take this action.
Okay. Then I will make a motion that the Board of Health grants to our health director, Melissa Ranieri, to take any and all appropriate actions under an emergency order to deal with the potential housing of COVID-19 patients at the, is it Home for Walpole or the Walpole Home? What's the correct title?
House of Little Wonders.
It's
Home.
the home in Walpole. It's
The home in Walpole? Okay. Do you need anything more than that?
No, that's good.
Okay. Do I hear a second?
I'll second it.
Motion's made and seconded. Is there further discussion? All in favor? Aye.
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 Sounds like 5-0-0.
But I had a question though. Isn't one of the quarantine conditions is to have like a separate bedroom and a separate bathroom? So how can they approve that?
So we haven't seen a plan in place, so that's something we definitely would need to look at, because obviously you can sanitize all you want, but if people are using the same bathroom multiple times a day, it's really, it would be very hard to actually properly sanitize those locations with that volume.
And how about the building? Is that located within a thickly, concentrated area? Like, are there a lot of neighborhoods? A lot of houses?
It's off Lincoln Road, where the Home for Little Wanderers is.
Okay.
All right.
I mean, shouldn't like the people, like the abutters, like,
Wait 1 second. Carol wants to say something. Can you hear Carol?
Years. And the house that they're referring to is actually on the other side of the street of the main campus, where all the academy is located, and all the residents, and the main dining hall, and the gym. So it's on the opposite side of the street. And so it's actually a 2-story home. I'm not very architecturally astute, but it's a single home. It's not near any neighbors, and it is across the street. The issues are, as have been mentioned, are the bathrooming situation. But I'm sure that can be looked into, and hopefully all the attention is given to it, all the inspections, and they can provide for this young person.
All right, sounds good. Anything else from you, Patrick?
No, I hope I'm not out of order here, but I did notice that there was another agenda item at the bottom here, recognizing the Board of Health Chair's 20 years of service. So I hope I'm not out of Thank you for your many years of service to the town of Walpole.
Thank you, Patrick.
Of course.
I have my own issues with that being on the agenda, but we'll deal with Melissa later on that one.
All right, sounds good. Have a great night, everybody.
Thank you so much, Patrick, and continue all the good work.
Thank you. You too.
All right, we have minutes to approve from the March 31st meeting. Are there any changes, corrections, additions, or deletions to those minutes? I went through them. Nothing jumped out at me, but.
I didn't find anything.
Carol, you're usually the eagle eye on those. Did you see anything?
I didn't see anything.
Ooh. Then we'll entertain a motion on those minutes.
Okay, I'll make a
Make
motion.
a motion that we approve the minutes as written.
Okay.
I'll
Motion has been made and seconded. Is there further discussion? All in favor?
Aye. Aye.
5-0-0. And we have a lifeguard variance, the usual one from the town. I wonder whether or not the pools will even be open this summer, but that's another question.
I know that's something we're gonna definitely hopefully get clarification for soon, because kind of under the umbrella of pools is our camps as well. And typically our camps normally submit plan reviews around this time. So
Sure.
hopefully within the next few weeks, we'll get some clarification on that.
Okay. Are there any questions or concerns about that variance? I know we've granted it every year for many, many years.
No.
All right, then I'll make a motion then that we grant the request for a lifeguard variance for the town of Walpole for the season of 2020, assuming that there is a season of 2020. Do I hear a second?
I will second that. I'll second.
Motion is made and seconded. Is there further discussion?
One thing I just wanted to mention.
Oh, go ahead, Richard.
So-
Sorry. Yeah.
They mentioned a couple situations that involve costs. One, training sessions or something.
Mm-hmm.
I wondered if we might find some funds to help with that cost, and if that would make it easier to find.
Oh, okay.
Lifeguard.
I think that budgetarily would have to be with the rec department. Yes.
Yeah.
I mean, we could certainly support them in their efforts, but I don't know that we've got any ability to directly do anything for them.
And I believe this has just been like every season they have the same issue, I think, with just finding lifeguards in general. I think in years past, lifeguarding used to be like the job to have, but now I'm finding through Cheryl that it's really hard to find lifeguards.
Right.
Okay. All right, so we have a motion that we grant the variance. Did I hear a second from anyone?
Yeah,
Yes, we did.
Richard seconded.
We did have a motion made and seconded. Is there further discussion? All in favor?
Aye.
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 Opposed, abstained? 5-0-0. We could skip over new business.
No, we cannot skip over Newman. We're putting it on right now to recognize you, Bill. However, we will be tabling it until we meet in person and we can have a cake to celebrate you as well. So,
Well, I guess
see it
20
again in the near
I guess 20
future.
years is
Something to celebrate, definitely.
a milestone. So
It is.
we'll
thank you
table
so
that
much for
until
your-
some future date when we can once again be in our little meeting room. How's
So we
that?
thank you for your service and we'll be grateful for another 20.
Thank you,
Yeah, I
Bill.
don't think so.
You know, we'll be lucky if we get one more
One.
year.
One more. And then under correspondence, we did have that COVID guidance from all of the different departments, very informational.
Yeah,
Is there-
so we update obviously the town website as we get, things are evolving by the minute, so it's hard to print out everything, but we figure we can
Right.
provide you at least with, some updates that might directly affect our department more than others, so.
Okay. Anything else that we need to deal with tonight?
I think that's it. The only question I have is, so I know Richard Bringhurst is the 132 number. Does anyone know who the end of 706 number is? I account for everyone that's on the call, and I think I'm seeing everyone, so I don't know who I'm
Is
missing.
that Carol?
That was
No,
actually,
Carol's on my
me.
phone.
Oh,
It's Rich. I couldn't get my computer fired up first.
oh
I
okay.
dialed
Okay,
in and then
perfect.
I
That's
did
good. I
All
thought
right.
it was a random. Okay, thank you, Rich.
So
Well, I know
Melissa,
it's a hot ticket to get. I know there's a waiting list for it. So.
You have to have your name on the list, Richard. or otherwise you
It's
don't
an
get in.
elite few.
so Melissa, what's going on with grocery stores now? Like, what are the restrictions? How I just don't understand how they're going to be, be able to exactly estimate what's their 40% their, normal occupancy. How's that going to happen?
I mean, they have their occupancy cards, obviously, from the building department, so they base it off of that. So they have to kind of have a gauge of how many people based off. So each building would be different because each building is granted different occupancy by the building department, and that's what they would go off of.
Okay,
And
so
a lot of them actually have counters at the door. They are physically letting people in. So they tell people when they can come in, and then they tell people to wait, and then they have other people exiting the other side of the store, and they have people there counting. So they try and keep the flow, so that they don't have more than that amount coming in.
but I have a concern
I
about
go early in the morning when the old folks can go. So
But then the people waiting up to go in, that's not creating social distancing. That's,
Well, what they should be doing while they're waiting in line, they should be showing, exhibiting social distancing just while waiting in the line. They shouldn't be, in groups. They should be spacing at least 6 feet apart while they're in line.
So I did speak to Walmart yesterday, and they did say that, and I haven't gone out to see it, but they said they have marked even outside 6 feet, so the people waiting to go in can see where they're supposed to stand apart to keep that social distancing in place.
gotcha.
Mhm.
Okay.
Well, hopefully the weather is going to warm up, because now too, like if you have elderly people going shopping and they have to wait outside in the cold, that's jeopardizing their health too. So, I don't know. I mean, if maybe if they just mandate everyone would wear a mask at least, or wear gloves and admit like people, I don't know. And that's another question, if we need to order like PPEs, would CDC be the one we would be contacting, or the PPH?
So it all depends who's ordering it. Like police and fire, they go through MEMA. Pretty much healthcare professionals are going through DPH. So it's all dependent on who's going to be utilizing the PPEs.
Okay.
I mean, right now it's going through the federal government. You can't even put an order in. We put an order in for the high school months ago before all of this, and the government intercepted it and took everything. So the federal government is controlling all PPEs right now.
All right.
Okay.
Anything else that the board needs to deal with tonight?
No, thank you all very much.
And we'll make a motion to adjourn.
Second.
Motion's made and seconded. All in favor? Aye.
Aye.
500. We'll see you all on the 21st.
Okay.